Greiner Bio-One presents MiniCollect Capillary Blood Collection System. Please note the instructions for use for the capillary blood collection. Ensure that the patient is clearly identified before each puncture. Prior to blood collection, it is recommended that the puncture site is warmed to help increase circulation. Simple heat packs can be used for this. Disinfect according to the guidelines of your institution and wait until the puncture site is dry. The tube cap opens upwards when you press on the ribbed area on the tube. The area marked with an arrow is to indicate the opposite side of the scoop. It is not recommended to touch the scoop while opening the tube. Perform the puncture with a suitable lancet. Position the lancet so that the cut crosses the friction ridges. This technique provides the greatest sample yield. Depending on the test procedure, it may be necessary to wipe off the first drop of blood with a sterile gauze pad. The first drop of blood may interfere with the analysis result due to a high content of tissue fluid. Hold the puncture site in a downward position. This prevents the blood from dripping away. The blood can be easily collected by holding the MiniCollect tube at an angle. You do not need any other equipment thanks to the integrated scoop. It may be wise to lightly move the tube around or gently tap it on a hard surface to release the droplet from the scoop. Fill the tube with the designated amount of blood to ensure an appropriate mixing ratio of additive to blood. When you have collected the required volume of blood, close the cap again. A clear, audible click means that the tube is properly and completely closed. To immediately stabilize the blood sample, gently invert the MiniCollect tube 8 to 10 times directly after capillary collection. Stop the bleeding by pressing with a gauze pad. Always follow the applicable guidelines in your institution to identify the patients and label the sample containers. When used in combination with a 13 by 75 carrier tube or pre-assembled as a complete combination product in 13 by 75 format, MiniCollect capillary blood collection tubes can be used as primary tubes, making them suitable for use with commonly used centrifuges and analyzers. MiniCollect capillary blood collection system includes in vitro diagnostic medical devices. Please observe the instructions for use for tubes and lancets, which can be downloaded from our website.